Currently, it's 52 right here in Newhall.
98.1 FM and AM 1220.
It is 8:39 coming up on 8:40 in studio guest. Good morning to Dr. Bud Lawrence from Henry Mayo. You are the medical director of the emergency department as well as the chairman of Henry Mayo's COVID-19 task force. A lot of hats you wearing.
Yeah, good morning. Thank you so much for having me.
Absolutely. So I'm going to assume, I'm going to go right there and say, since you are the chairman of the COVID-19 task force, we're probably going to talk about COVID-19.
I think we should. I think
Okay.
that's the topic of the last 2 years, right?
Can you believe it?
You
must be just exhausted.
It has been a bit exhausting, but I have to say all healthcare workers, I think, are exhausted, and I think all community members are exhausted. It's been quite a bit.
So let's start. How about we start with the Omicron? And I think I'm saying that right. It's Omicron, right?
That's correct.
Because there have been a lot of mispronunciations. I think it was one of the top words of last year, mispronounced words, right? Omicron, like Macron. Okay. The variant has, speaking as a layperson and not a medical person, anyone who has been getting it, which is a lot of people, it's very, 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 very contagious, acting more like a sore throat, a cold. It's been a little bit on the minor side, but very contagious. So more people are getting it, but it's not taking you down completely unless you're unvaccinated. Speak to me about that.
What you said is actually absolutely correct. It's a much more virulent strain of the virus because of the mutations that it's had. And even though Delta was fairly contagious, this Omicron is much, much more contagious. And what you're describing is also true. What we are seeing in the community is that patients are having more of a sore throat, fever, headache kind of symptomology. It tends to appear that it mostly is affecting the upper airway. So it's more like an upper respiratory illness or upper respiratory tract illness. It doesn't really get down into the lower lungs quite as much. So we're not seeing all of the major lung issues we've been seeing with previous surges of COVID, where we see people on ventilators for long periods of time, rates of mortality that are somewhat unacceptable. So we don't see as many people dying from Omicron. People in general are doing quite well with it. And you're right, it is definitely much more a riskier situation if you're unvaccinated. But people who are vaccinated are also getting Omicron. We do sort of recommend, if you are vaccinated, consider the booster, only because what we're seeing is that people that are boosted tend to do a bit better against Omicron than people that are not boosted.
Are they more likely to deflect it completely or just, again, the symptoms go down?
It's hard to say. I don't think there's enough data out there to really speak intelligently on that, but I think that there's a possibility that it's protective to have the booster against Omicron. It's also a possibility that they just have a much lighter course of illness, so much so that they're asymptomatic and potentially have a lower viral load and maybe not as contagious. But again, this Omicron is contagious, very contagious. I sort of feel like everybody out there is getting it, and which is a bad thing. We don't want people to get sick, but also if the course of illness is so mild that no one's really dying from this, or a relatively much lower number of people are dying from this, working its way through the community might afford the community protection against COVID in general, and this is sort of how the Spanish flu sort of fizzled out. So there is maybe a silver lining to the cloud, as it were, but that's, it's hard to say. There's not enough data on that.
So we're going to circle back to that because I do have a question about what we just said, but what I want to ask before that is kids who can't have the vaccine under 5, I believe it is. How are they faring through this? I mean, are we concerned for our kids? Because I know that they have a tendency to, the smaller you are, I've seen on the news that they are better with infection because they're smaller and they deflect it a little bit better than older people. But how are they faring? What are you seeing at your hospital?
In general, I would even say across the country, I was actually talking to another physician about this, really smaller kids in that younger age group, we don't see a lot of COVID. We don't see a lot of COVID positivity, actually, particularly in the much younger kids in that sort of 0 to 2 or 3 year old age group. for whatever reason, their immune system, they're just able to, maybe they're just built to go into like that preschool, kindergarten virus mill that every child the gauntlet kids have to make it through in life to build their immune system. And they tend to do very well. So we don't see a lot of kids in that age group getting sick. We do see with Omicron, maybe some kids in the older age group are getting sick a little more frequently. But again, I think everyone's getting sick a little more frequently from Omicron. It's just that much more contagious.
Do you suppose, now we're going to circle back to what we were just talking about as far as immunity is concerned. If so many people are getting Omicron and just having these mild symptoms, is it possible for us to achieve herd immunity in the future, even with different variants?
Answer that's tricky. I think that you take the variants out of the equation. I think absolutely it's a very reasonable possibility that we could get to herd immunity with Omicron just based on how virulent it is, how infectious it is and contagious. But the problem with this is that these mutations, I've said this the whole time, it's just a mathematical equation. These viruses mutate a certain number of times that they replicate. Each replication brings on a risk of mutation. And so the more viruses that are out there, the higher likelihood that we're going to have a mutation. And with Omicron getting so many people sick and it's so infectious that there's a lot of viruses out there right now. And this brings on the idea that potentially there could be further mutations that could set us all the way back to ground zero. So I'm not a fear monger. I don't try to say things to freak people out, and that's certainly not the intent of this. It's just the reality of math, which is that having more viruses out there makes it more likely that there's going to be a mutation that could benefit the virus. Also, there could be a mutation that is non-beneficial to the virus and causes it to fizzle out quicker. It's impossible to predict.
How did we do this with the Spanish flu? Like, how did we finally get that to fizzle out?
I think that it just is sort of similar to what we're seeing here, which is you have a strain of the virus that is infectious but doesn't cause a lot of serious illness, and that then allows everybody to get the infection. And once everybody gets the infection, the population as a whole just moves on, and it becomes just something like the common cold.
Have you been seeing Omicron affect Henry Mayo as far as personnel is concerned?
Yeah, absolutely. I mean, I think that the hospital is a very good marker for where all hospitals are nationally. So across the country, there are severe challenges with nursing shortages, and we see the same at Henry Mayo, whether that's from nurses leaving to take jobs that are higher pay elsewhere, or nurses retiring, actually, because there's been many people retiring. So it's tough to staff from that standpoint across the country, and then you add on this really virulent strain of virus that's causing people to get sick. And so just as you see it in the community, nurses are people, hospital staff are people, and physicians are people. So we are seeing people getting sick more frequently, and then we now have further holes in the schedule from people having to be out from illness, which is, we never want anyone to be sick, but we also don't want to have holes in the schedule. So it's kind of a challenge. It's an extremely challenging time right now at all hospitals, and I think just same as with Henry Mayo, I think that what I would like to echo that others have said is, just to have patience when you come to the emergency room, for example, because we have, number one, a lot of people are sick. A lot of people have Omicron. They've come in. They want to be evaluated. And then we have this perfect storm of, we also have less nurses from this generalized staffing shortage across the country, as well as people just getting sick themselves as they're on the front line trying to help save lives. So I think one thing is, I would say, just to try to ask for some patience. Henry Mayo has a tent system set out outside the emergency department to help facilitate the higher volume and also help facilitate safety of patients that show up at the emergency department. We want to make sure that we're treating everybody safely, that we're kind of cohorting our COVID patients in one area so that we're not, so that it's clean and safe for others to come. We have seen in the previous surges that people delay their medical management of chronic conditions, or you get a little sick and you think, well, I would go to the hospital normally for this, but I don't want to go to the emergency room or the hospital because there's COVID there. And that delay in care is really this other weird wave of illness that we've been seeing in the medicine community, that people are coming in much sicker, and they're coming in with time-sensitive issues like heart attacks and strokes. They're coming in very late, and that's something that's causing them to have worse outcomes.
So, Dr. Lawrence, question on that then. So, where do we stand? So, let's say hypothetically, I'm at home and I'm not feeling well, or I have some kind of chronic illness unrelated to COVID. At what point, because everyone's nervous, going into a hospital, what do you suggest? What do you tell them as far as just being safe? Mask up, perhaps. What's that cutoff of not having to go to the ER and having to go to the ER, and how do we become the safest patient going in? So I've decided I got to go to the ER. What do I do then?
So first off, to go to the ER or not to go to the ER, I'm going to say the same thing I've always said, which is prior to COVID, if you had a concern that you would have gone to the ER for, you should go, because we don't want you to think to yourself, well, there's COVID there. People have COVID in the community. I don't want to leave my house, whatever. That's where we end up seeing worse outcomes, because many of these things are time sensitive. So if you were going to go before, you should go now. I think that you can protect your own little sphere. You can do the things that help protect you, which are things that we've said the whole time, which are wash your hands, don't touch your face and eyes, wear a mask. You can wear an N95 mask and you can go most anywhere, and you're going to be very well protected. If you don't have an N95 mask, I think that the current recommendations are coming out that you really should probably consider getting a surgical mask over a cloth mask. They probably work a little bit better. And protecting against Omicron in particular.
Well, that's what I did see on the news last night, is that the particles for Omicron apparently are smaller. So they're penetrating fabric masks, and they suggest you do the candle test. And this is, I don't know if the medical, you guys know about the candle test. If you can blow out a candle with your mask on, then it's not good.
I would probably say that's a reasonable assessment of that. I would say that I don't know that Omicron is necessarily smaller than the others, the other strains that we've seen. I think it's more that it's so contagious. There's less of a safety barrier there. Like you have to get a certain number of viruses in your body to get infected. And with the initial coronavirus, for example, let's say you had to get 100 viruses in your body to get affected. These are made up numbers. With Omicron, maybe you only need to get 10.
Gotcha.
So there's more of a risk of just a small amount of virus getting into you with Omicron can get you infected.
Dr. Bud Lawrence from Henry Mayo, medical director of your emergency department, chairman of Henry Mayo's COVID-19 task force. If anyone has any questions, do you have a website perhaps with frequently asked questions or anything we can refer to?
Yeah, we do. We do have there's a link at Henry Mayo, henrymayo.com, I believe is the website for the hospital. And you should be able to find a link there with coronavirus information that's provided by the hospital for education. I'd also refer people to the LA County Department of Public Health, has a lot of good information, as does the CDC. I also just want to remind everyone to stay in contact with their primary physicians. I think every primary physician, whether you're a pediatrician or an adult doctor, we've all become specialists at COVID at this point, right? So they're a very good resource. And I think the more contact you can have with your primary physician as well, the less likelihood you're going to have this delay in managing your chronic conditions, that then we are seeing people be coming into the hospital much sicker than they should be, and not getting the outcomes that they would have otherwise received pre-COVID.
Thank you so much for all the information. Dr. Bud Lawrence from Henry Mayo Newhall Hospital. Thank you so much. Happy New Year.
Happy New Year to you, and thank you for having me.
How are we all doing today?